Fight against COVID-19 in Nigeria has received a boost as the country has received 26 ventilators and other equipment from the World Health Organization. Nigeria also took delivery of 3,560 fingertip oxygen pulse oximeters as authorities step up efforts to curb the spread of the disease in the period of a third wave. Minister of Health Dr. Osage Ehanire received the donation items on behalf of the federal government on Thursday in Abuja. The items were delivered on the same day Nigeria recorded its highest daily infections in 6 months, amid a strike by resident doctors in the country and growing concerns about widespread protocol violations by citizens. Dr. Ehanire expects the ventilators to come in handy in the race to halt the spread of the pandemic. Meanwhile, the Nigeria Center for Disease Control (NCDC) has reported 566 new cases of COVID-19, taking the country's total number of confirmed cases to 176,577. Lagos recorded the highest number of new cases with 283 new infections, followed by Akwa Ibom with 88 new cases. Oyo and Rivers states recorded 62 new cases each, while the Federal Capital Territory recorded 18 new cases. So far, 165,323 people have been discharged, while 2,178 people have died from COVID-19 complications. Let's inquire from the head of department, ENT Department, University of Abuja, Professor Titus Ibekwe, on the call for more people to be vaccinated. Professor Ibekwe, it's a matter of how much vaccines that are currently available.
So good to be.
Thank you so much for coming. I'm asking that, is it a question of whether Nigerians will want to be vaccinated or not? Or perhaps a question of, do we have enough jabs on the ground to get more people vaccinated?
Yeah, the experience from reports coming from different centers, including University of Abuja Teaching Hospital, which is one of the major vaccination centers here in Abuja, show that initial response by the citizens, even the health workers, wasn't encouraging. But as time progresses over time, I believe that enlightenment program was taking deeper roots into our fabrics. The response kept increasing. Initially, they were moving around, literally soliciting that people should come and take the various jabs. Of course, I was one of the first that received the jab because when you have had an encounter with this deadly disease, then nobody will prompt you to do that. The experience over there was that towards the end of the first phase of vaccination, there was a surge in the number of people that were interested in having the jabs. And by then it was already late, and they were assured that once the second phase commences, which is the phase we're entering into now, that there will be availability. However, there's still need for a lot of sensitization and enlightenment program, because if there could be hesitancy among even the health workers. So you could imagine how the common man in the society and the street feels. Yeah, but by and large, I would say that the NCDC and National Primary Healthcare Development Agency and Ministry of Health, that they have done well in trying to institute some training among health workers to propagate this information, down to the different nooks and crannies. But the response we're getting shows that more work actually needs to be done for us to be able to get it right. Now we have Moderna vaccines coming in some fractions over 4 million. it should not be allowed to waste. It should be received by people who are qualified to have this.
Indeed, Prof. You agree that the initial low turnout of some people might just be waiting for people like you to take the vaccine and see how you react. According to you, the numbers eventually picked up. But the current plan is such that to achieve herd immunity, it will take Nigeria some 2 years. What's the implication of that at the wake of a third wave?
Absolutely. That's what it means to each and every one of us, is that the key remains as much as possible preventative, prevention, which is what we popularly call the non-pharmaceutical measures. That is number one, then followed by the vaccine. Because of course, we know that Nigerian population is massive, and you can see the volume of the vaccine coming in. One would not be too far from saying that it's like a drop compared to those that actually need this. But the more people get vaccinated, the more we're heading towards that, health immunity. But the most important thing, even till tomorrow, remains the non-pharmaceutical, measures, i.e., physical distancing, as much as possible, wearing your mask and keeping good respiratory hygiene, washing your hands regularly, and all these things, as far as I am concerned, it costs nothing. All that it costs is discipline. Once people are disciplined and keep this checkmated, you don't wait to become a victim, before you start struggling to save yourself. Intelligent people learn from other people's mistakes. It's ravaging different parts of the world as we're talking now. Senegal is the latest. They're all struggling with their healthcare, personnel to cope with the rate of infection that they have there. Tunisia has been struggling, and South Africa, all around us here. So let's not think that it's completely over. We're very blessed people, let me just put it that way. We may not be able to explain certain factors that actually lead to
that factor is perhaps why many Nigerians are also taking it for granted. Professor Titus Ebekwe is head of department here at the department at the University of Abuja. Thank you for talking to us on the news tonight. We'll